Hi all, thanks for joining me for ACEP's Capital Minute, a look at what's happening in Washington right now that's affecting emergency physicians and patients. I'm Laura Worcester. Just as a reminder of our new format, in the next 20 minutes or so, I'm going to give you an update of what's happening in Washington, D.C. and how it might affect you as an emergency physician. After the brief overview, we'll open it up for questions. You can submit them at any time along the way by using the Q&A feature at the bottom of your screen, and then I'll answer them live after my update. Let's just get started. Last week, emergency physician and member of Congress Raul Ruiz from California, and Representative Roger Marshall of Kansas, also a physician, introduced H.R. 6910, a bill that would ensure every emergency physician has medical staff due process protections. The legislation would require that the Secretary of Health and Human Services to issue regulations that would provide due process rights for physicians providing emergency medical services. ACEP worked closely with representatives' offices on developing this legislation on this important issue for ACEP members. Specifically, the regulations would ensure physicians who are employed by or under contract with a hospital to provide emergency medical services would have a fair hearing and appellate review through appropriate medical staff mechanisms before any termination or restriction of their professional activities could be instituted. These protections could not be denied through third-party contracts. ACEP just sent an advocacy alert last night to our 911 grassroots advocacy network, encouraging our members to send an email to the representative and encouraging them to co-sponsor the bill. You can find a link to send your own email to your member of Congress on the screen. ACEP is also leading the way to dismantle current barriers for physicians who are seeking mental health treatment and reduce the stigma of physicians' mental illness. ACEP continues to express our strong support for the Joint Commission stance that a health professional history of mental illness should not be used as any indication of their current or future ability to practice medicine, which we covered during the last edition of the Capital Minute. In addition, we are leading the development of a statement co-signed by over 10 leading medical societies and mental health experts so far, asking state licensing and credentialing agencies to better encourage professional support and non-clinical mental health initiatives, such as peer support for physicians. These agencies can also expand access to treatment programs and make sure that any physician is able to refer themselves to treatment without fear of reprisal. In addition, we have been working with Representative Krishnamurthy of Illinois' office on some mental health priorities, including research on mental health impacts of COVID-19 on physicians and other frontline healthcare providers, a provision that was included in the HEROES Act that was passed the other week. ACEP recently also supported Representative Krishnamurthy's bipartisan Dear Colleague letter that now had 90 co-signers on it regarding mental health impacts and access to resources for healthcare workers responding to the pandemic. On May 18th, ACEP sent a letter to Congress and Health and Human Services Secretary Azar supporting H.R. 2482, the Mainstreaming Addiction Treatment Act of 2019, which removed the X waiver requirement mandated by Data 2000 or the Drug Addiction Treatment Act, which requires physicians wishing to prescribe buprenorphine outside of opioid treatment programs, otherwise known as OTPs, to take an 8-hour course and receive a waiver from the Drug Enforcement Administration. ACEP firmly believes that the presence of this X waiver requirement has led to misperceptions about medication-assisted treatment and has increased stigma about opioid use disorder and the treatment of this disease. Due to the burdens the requirement creates, as well as in some cases the stigma, some physicians are not willing to pursue this DEA license or even engage in treatment of patients with opioid use disorder. So removing the X waiver requirement has been a key policy priority for ACEP. And given that we're now at over 100 co-sponsors for the bill, I think we're making traction in Congress. We'll keep you posted on new updates and ways you can help move the issue forward. That wraps up our federal advocacy updates, so I'll start taking your questions. Remember, you can submit them using the Q&A feature of Zoom on the bottom of your screen. Okay. Let's see what questions have come in. Just give folks a second. So the Joint Commission statement is strong, but does it have any teeth when it comes to enforcement at the hospital level? So right now it doesn't, because this isn't an area that the Joint Commission directly regulates or includes in their site surveys. But our hope is that because hospitals hold the Joint Commissions in high regard, or let's say have a lot of concerns about what the Joint Commission thinks of how the hospital is operating, we're hoping that the Joint Commission statement will at least be something physicians can point to when hospitals, start to take into account some of this private information in their credentialing process. See if there's any other questions coming in. The relief proposals seem very partisan. What's the likelihood that we see mental health resources included in final legislation? That's a really good question. Right now, the next COVID package has started to become a little partisan. And on the Democratic side in the House, Speaker Pelosi introduced a couple of weeks ago the Democratic proposal for the next package. But really, that was just a marker of a lot of the priorities that Democrats have signaled on COVID-19 and the pandemic. Kind of in reaction to that, or also leading up to it, Senate Leader McConnell had not put out yet the Republican version on the Senate side, but had signaled some key priorities, including very broad spread liability reform, not just for healthcare, but for businesses and others, manufacturers, private businesses, small stores, things like that, as a priority, which he sort of knew was a non-starter for a lot of Democrats. And he had said that he wouldn't really move anything in the Senate unless those big liability protections were included. So right now there's a little bit of a partisan stalemate, kind of externally at least, but to our understanding, there are some conversations that are taking place bipartisanly on another COVID package. This would be the fourth major package. So we think there is a decent chance of some movement over the month of June. Originally, we'd hoped it would be in May. So because of this kind of partisan divide, I think that slowed things down. But I'm still hopeful that something can progress. The other kind of aspect of this is that the White House needs to be on board with it too. So it's not just McConnell and Pelosi who have to negotiate with each other, but they also have to negotiate with the White House, since ultimately they're the ones who, the president would be the one who signs the legislation into law, and could essentially veto it if there's a lot of things in there that the White House is opposed to. So there's sort of no point in them negotiating something just between each other if the White House isn't on board, because even then, if it's passed, it won't go any further. So that's kind of the other consideration. That being said, that's a very long answer to the question, but I think should there be a fourth major COVID package, I think there's a very good chance of mental health resources being included. I think there's growing recognition of the importance of this issue and what emergency physicians and other frontline providers are facing in this crisis and the stress that it's placing on them. So I think that including it in the legislation should be a reasonable ask. It's just a matter of getting legislation to move. Let's see, there's a question. Removing the X waiver sounds sensible, but are we still working with HHS to modify the 3-day rule and remove pre-authorization? Yeah, that's a great question. We are in touch with HHS almost weekly on this issue. We check in a lot, and there is, from the folks we've talked to, there is a desire to modify the 3-day rule. The 3-day rule allows an exemption to the X waiver for emergency physicians to administer buprenorphine in the emergency department for up to 3 days. But the trick is that it has to be given 1 day at a time. So the patient would have to return 2 more times to get 2 more doses, up to 3 days, in order to be able to have this exemption from the X waiver. And you guys know more than anybody how difficult it is to ensure a patient comes back to the ED 2 days, 3 days in a row, much less a patient who's, under challenging conditions, facing potential withdrawal, and opioid use disorder. So ACEP has been advocating for the last couple of years for that 3-day waiver to be relaxed somewhat. We think that it is within HHS's authority and would not require congressional action, whereas removal of the X waiver entirely does require congressional action. Whereas the 3-day rule, if we can get them to relax it so that you're allowed to at least administer up to 3 days at a time in a single emergency department visit, that could at least let patients have a little bit of a head start towards seeking follow-up care in the community. That gives them at least 3 days to be able to find follow-up care in the community and be connected to resources versus having to come back each day while they're also trying to find community resources, which is a challenge for anybody, really. All right, so another question is, I still need more PPE. Is there any recent progress towards getting the federal government to centralize PPE distribution? So there hasn't really been a lot of progress, I think, specifically on the centralized PPE distribution. That being said, the Defense Production Act, I know, has been further invoked to help in getting more PPE manufactured. So the hope is that there'll be more PPE coming out of the pipeline, but there is still this challenge of the distribution not being centralized, and really has left a lot of states kind of almost competing with each other to get access to it. And then once they do get access to it, we've heard a lot of stories that the states have to really guard it as it's being delivered or coming off the docks or transport to make sure that it doesn't get taken away by anyone, essentially. So that's still an advocacy priority for ACEP, is pointing out the need for centralized distribution of PPE. Okay. Question. I just read the latest Regs and Eggs blog. Is there an update on our telehealth efforts? For those of you who don't know, the Regs and Eggs blog is written by our Director of Regulatory Affairs, Jeff Davis. That comes out every Thursday. You can find it on acep.org. Really, you can just Google Regs and Eggs, and it should come up. And really, he does a deep dive every week into the latest regulatory issues that ACEP is working on. On our telehealth efforts, there isn't an update quite yet, but the update, really what Jeff talks about, is really the latest news on it. We had a big victory by getting the emergency medicine telehealth codes recognized, at least temporarily, for the duration of the pandemic by Medicare. And that's a great first start. That's something we've been trying to get on a permanent basis since before I even started at ACEP. I know it's been at least probably 6 or 7 years that ACEP has been trying on that front, and really was just hitting a brick wall each time in the payment rules, the Medicare payment rules. So as Jeff covered in his blog, reg season is coming up since it's summer. So probably end of June or July, we'll be able to see a proposed rule, which will give us an opportunity to see if they've already addressed the telehealth issue in that. I think there's a good chance they may not, at least not on a permanent basis, but because we respond to the proposed rule with comments, that gives us another opportunity to strongly advocate for inclusion of those emergency medicine codes on a permanent basis on the telehealth side. Okay. Let's see. It's hard to keep track of all the federal activity that ACEP is doing. Is there a website that can update me on all our progress? Yeah, there actually is. So there's 2, I would say, key areas that you can check out. One is, if you go to acep.org, you'll see under the advocacy header, there's a federal advocacy section, and that covers a lot of our letters to Congress and our regulatory work. The Regs and Eggs blog is there. But the other place that you can also look, if you're looking for federal activity related to the pandemic, is just go to acep.org/COVID-19. And there's a pretty prominent federal activity section there that's constantly being updated, because so much guidance and waivers and congressional action is coming out on this issue almost daily. So that's really your best bet to get the latest on the COVID-19. All right, I think we have one last question left. Question is, I want to talk to my member of Congress about these issues. Will there be opportunities for in-person meetings soon? If not, how can I get involved? So I don't think there's going to be any opportunities for in-person meetings, at least for the next few months, probably. DC is only just starting their reopening. Phase 1 begins this Friday, but that is still strongly encouraging telework. So businesses are not open, non-essential businesses at least are not open. And I know members of Congress are still encouraging as many of their staff as possible to telework. Right now, if you want to meet with a congressional staffer the way you normally would have, they have to come downstairs to the security area of the congressional building, meet you, escort you all the way back up to their office, and then at the end of the meeting, escort you all the way back. And for those of you who've done the congressional meetings, you know that a lot of times they're 10 minutes at most. They're pretty efficient. So for a staffer to have to walk, which is probably a 10-minute walk each way, depending on where their office is located, just to escort you up, it's not going to happen unless it's like an absolutely really critical VIP type meeting. And even those I'm not sure are really happening much at all. So no in-person meetings, but there are opportunities to get involved. Another great opportunity is if you join NEMPAC. They are starting to host, I think they're bi-weekly virtual happy hours with members of Congress and other experts. And those have been really effective so far. I think we had Representative Raul Ruiz a couple of weeks ago. This week, they're going to have Nate Gonzalez, who is an elections expert, and he'll be talking about the upcoming congressional and presidential elections this November, which will certainly be different, I think, this year. And then there'll be future ones with members of Congress also planned just, I think, for the next couple months. So that's another great way to get involved. And you can reach out to Jeannie Slade or Sarah Heckman from the ACEP staff if you have questions or want to see about joining NEMPAC. So I think that's all we have time for today in terms of questions. So thank you everyone for joining us, and we look forward to seeing you in 2 more weeks for another ACEP Capitol Minute. Thanks for joining us. I'm Laura Worcester.